My great-grandfather was an inventor. And his most famous invention is that obnoxious dinging sound that happens when you get in the car and don't fasten your seatbelt. And I don't even think that invention has a name, but everyone here knows what I'm talking about, right? And that's because that mechanism is built into virtually any car you drive today. And it's there because it serves an important purpose. Driving in a car is one of the most risky things you'll do on any given day, and fastening your seatbelt is a simple yet effective way to reduce that risk. What I'm here to talk about today is applying that same logic of creating practical strategies that make a risky activity safer. But instead of talking about the number 2 cause of accidental death in the United States, which is car accidents, I am here to talk about the number 1 cause of accidental death, which is drug overdose. This philosophy is called harm reduction, and at its core, it's all about creating practical strategies and tangible ideas that reduce the harms and risks of substance use. And harm reduction as applied to drug use is a lot more controversial than other things like seatbelts or airbags or helmets or sunscreen that are designed to keep us safe. And that's because all of us are taught a very rigid set of beliefs about substance use. If you're in my generation, you might have grown up going to DARE class, right? You learn to resist drugs and violence. In my parents' generation, you might have learned that this is your brain on drugs. These are examples of America's abstinence-based view of substance use, which means that we're all taught to believe that the only way to stay safe from substances is to not use them at all. And growing up, I never thought to question this philosophy until I came to college here at Ohio State and made friends with a group of people who were engaged in harm reduction work. I started reading and learning about this philosophy. I became the director of operations at a harm reduction nonprofit called the Sauer Initiative, which provides overdose prevention resources to Ohioans in almost every county throughout the state, where I learned how dangerous this has become for communities right here in Ohio. I even had the chance to work with the National Institutes of Health, analyzing data about emerging drug trends, charting in real time how this problem was affecting communities across the country. But after all of that learning and all of that experience, I can still stand here today and tell you the reason why the abstinence model will never work in just 6 words. Lots of people use drugs anyway. And it's difficult to quantify exactly how many people or what % of people use drugs, right? Because if you give people a survey and say, do you do this illegal activity, you don't get great data. But here's what we do know for certain, is that in 2021 alone, over 106,000 people died of a drug overdose. And if that many people died, imagine how many millions more people were using substances and were at risk for an overdose. The most important thing to know about this number is that it's not normal. According to the CDC, there were under 20,000 drug overdose deaths in 1999, and that number has absolutely skyrocketed to where we find ourselves today. Even though this time period is a period where we've done things like DARE and tough on crime laws that have doubled down on that abstinence-based approach with the hopes of curbing substance use. But clearly, people haven't stopped using substances, and they certainly don't have the tools and resources to do so safely. So if our goal is to halt this trend, to stop these preventable deaths, we have to turn to a new approach. And harm reduction offers the perfect opportunity for a fresh start. For example, one reason why we see this trend is a drug called fentanyl. Fentanyl is a potent synthetic opioid, meaning it's man-made. It was actually created to treat patients with severe cancer pain. That's how strong it is. But what's happening is things like this, where pills and other substances, things like Adderall, Xanax, oxycodone, as you see here, even cocaine, heroin, MDMA, are being sold as these drugs, but actually contain a lethal dose of this drug, fentanyl. And this happens because people who use drugs don't have any of the same consumer protections that we do when we use legal substances. When I go to the grocery store, for example, and I want to buy something that I'm consuming, thanks to the FDA, I'm able to look at a complete and accurate list of exactly what's in that substance and make an entirely informed choice about what to put in my body. But people who use criminalized substances don't have that same luxury. So what happens is people are taking pills or substances that look normal, but actually contain something different and something deadly. Now, the abstinence-based approach would look at this problem and just say, well, don't take this pill. But harm reductionists recognize there's a lot of reasons that someone might take this pill. It could be a teenager who's experimenting with substances for the first time, or someone with a substance use disorder who struggles to control and have autonomy over what they're putting in their bodies. It could be someone who full well knows the risks and the consequences and just makes a dangerous decision that day. None of those people deserve to die. That's why harm reductionists created a tangible tool called fentanyl test strips. And for just 50 cents and 90 seconds of your time, these thin paper strips will tell you whether or not there is fentanyl in a substance. So with these test strips, you're able to tell the difference between these two pills, something you would never have known before without harm reduction intervening. Fentanyl test strips are just the tip of the harm reduction iceberg. One of the most tried and true and original harm reduction strategies is something called a syringe exchange or a needle exchange. This image shows a needle after 0, 1, and 6 injection drug uses. And as you might expect, that 6-use syringe is an incredibly dangerous material to be putting into your body. But people who inject drugs often do so several times a day and lack access to use a clean syringe every single time. So they turn to reusing these used syringes, or even worse, sharing with people around them, which contributes to the spread of communicable bloodborne diseases like HIV and hepatitis C. So what a syringe exchange does is allows people to bring in these used and dirty syringes and trade them for fresh ones, so that if people do inject drugs, they're able to do so without causing permanent damage to their bodies or spreading these diseases around their communities. Another harm reduction strategy that is incredibly simple is distributing a medicine called naloxone. And you might have heard it called by its major brand name, which is Narcan. And what Narcan does is it can reverse an otherwise fatal opioid overdose. So if someone uses a quantity of heroin or fentanyl or any other opioid type of substance that normally would have been enough to kill them, this medication with a simple squirt up the nose can stop that overdose process from happening and save that person's life. So one powerful harm reduction strategy is just to get Narcan in the hands of as many people and places as possible. Personally, I carry Narcan with me in my backpack wherever I go. If I'm going to an event where substance use might be occurring, I just stash it in my purse. Simple things like that increase the probability that if someone does overdose, there'll be Narcan in the vicinity to save their lives, preventing that overdose from becoming a fatal overdose. Harm reduction strategies can also be more complex and technologically advanced. In Chicago, Illinois, there's a group called the Chicago Recovery Alliance. And this team drives around the city of Chicago in buses stocked with chemical laboratory equipment. And people in the community who are using substances can bring their drugs onto the bus and have them tested in this laboratory equipment, which spits out a full report of the chemical compounds that are actually in their substances. It gets them one step closer to that grocery store model, where you're able to see exactly what you're taking and make fully informed and autonomous decisions about what you actually want to put in your body. Whenever I talk about harm reduction, I always want to highlight the most amazing part about all of this, which is that these innovations were pioneered by people who use drugs for their own communities. For example, fentanyl test strips are actually manufactured and marketed as urine tests. So their original use case was that if someone's been using fentanyl, you can catch them by testing their urine. But when people's drugs started being laced with fentanyl, they realized that with just the right ratio of water, which is different for every single substance, they could test their drugs before they took them. creating an entirely new purpose for this product that revolutionized harm reduction and made their communities so much safer. I think we have this idea in our heads of what a person who uses drugs looks like and what they're capable of. And at least for me, this idea was cultivated by things like DARE and after-school specials that paint a very negative and stigmatizing view of people who use drugs. But as I've worked in harm reduction, I've had the privilege of interacting with people from all walks of life who use substances. I've worked with accountants, engineers, farmers, therapists, literal geniuses, all types of people who use substances, and it shattered the mold in my head of what a person who uses drugs looks like and what they're capable of doing and contributing to their communities. Right now, we are in a critical time for drug use in our country. On the one hand, it's a devastating time when more people than ever are dying preventable drug overdose deaths. All of these people I've met in my work will be the first to admit that without harm reduction, many of them would not have been alive today, and I would never have had the privilege of meeting them and calling them my friends. But on the other hand, it's a time of great hope, a time when harm reduction practices are finally starting to go mainstream and get the funding and the recognition that they deserve. So it's up to all of us in this crucial moment to rethink the abstinence idea and open up our minds to a broader range of solutions to this overdose crisis. Things like harm reduction that put the people who use drugs first and prioritize their needs. A common critique of harm reduction is that it sends the wrong message about substance use. And in a society where people who use drugs are so stigmatized and so criminalized, it's easy to see how the message of harm reduction can get lost in translation. But at its core, harm reduction tells people who use drugs this: we love you, we accept you, we care about you, and we will do whatever it takes to keep you alive. And I can't think of a message that is more worth sending. Thank you.